Welcome to Modern Group of Institution. In BP 107P, Practical Anatomy and Physiology, I, Ankur Joshi, Associate Professor at Modern Institute of Pharmaceutical Sciences Indore, deliver you about axial bone of skeleton system, that is how to identify axial bone of skeleton system. The contents of practical are object, reference, and theory. The object of practical is to identify axial bones of skeleton system. The main reference book for this practical is Scalanon C. Verily and Sandertina, Essential of Anatomy and Physiology, E. A. Davis and Company, 5th edition, 2007, page number 112 to 128. The second reference is Totora J. Gerard and Derrickson Bryan, Principle of Anatomy and Physiology, John Willey and Sons, 12th edition, 2009, page number 202 to 231. Now, what is axial skeleton? The axial skeleton is a part of skeleton that consists of bone of the head and trunk of the vertebrae. In the human skeleton, axial skeleton consists 80 bone and is composed of 5 parts. The axial skeleton forming this structure constitute the central bony core of the body, the axis. The axial skeleton bones are as follow. It consists skull bones, skull bone. In skull bone, it is divided into 2 parts. Cranium consists of 8 bone. Facial bone consists of 14 bone. Ossicle of the middle ear, 6 bone. Hyoid bone, that is 1 single bone. In thorax, sternum, 1 single bone. Ribs, 24 bones. And in vertebral column, 26 bones. Total number of bones present in the axial skeleton are 80. As you can see that the total of all this bone is 80. Now, first of all, we talk about skull, and the skull rests on the upper end of the vertebral column and its bony structure is divided into 2 parts, the cranium or cranial bone and the face, that is facial bone. Now, first of all, cranial bones. The cranium is formed by the number of flat and irregular bones that provide a bony protection for the brain. It has a base upon which the brain rests and a vault that surrounds and covers it. The periosteum lining the inner surface of the skull bone forms the outer layer of dura mater. In a mature skull, the joints, suture between the bones are immovable. The bones have numerous foramina and fissures through which the nerves, blood vessel and lymphatic vessels passes. There are total 8 cranial bones, 1 frontal bone, 2 parietal bone, 2 temporal bone, 1 occipital bone, 1 sphenoid bone, 1 ethmoid bone. Now, first of all, we talk about the frontal bone. This is the bone of the forehead. The frontal bone is the bone of forehead. It forms the part of the orbital cavity and prominent ridges above the eye, the supraorbital margin. The second bone is parietal bone. This bone forms the side and roof of the skull. They articulate with each other at the sagittal suture, with the frontal bone at the coronal suture, with the occipital bone at the lambdoidal suture, and with the temporal bone at the squamous suture. The inner surface is concave and is grooved to accommodate the brain and blood vessels. The next bone is temporal bone. This bone lies on each side of the head and forms the fibrous immovable joint with the parietal, occipital, sphenoid and zygomatic bone. Each temporal bone has several important features. The next bone is occipital bone. This bone forms the back of the head and part of the base of the skull. It has immovable fibrous joint with the parietal, temporal and sphenoid bone. Its inner surface is deeply concave and concavity is occupied by the occipital lobe of the cerebrum and by the cerebellum. The occiput has two articular condyles that form condyloid joint. The next bone is sphenoid bone. This bone occupies the middle portion of the base of the skull and it articulates with the occipital, temporal, parietal and frontal bone. It links the cranial and facial bone and cross braces the skull. On the superior surface, in the middle of the bone, is a little shadal shaped depression known as hypophyseal fossa, in which pituitary gland rests. The next bone is ethmoid bone. The ethmoid bone occupies the anterior part of the base of the skull and helps to form the orbital cavity, the nasal septum and the lateral wall of the nasal cavity. On each side are two projections into the nasal cavity, the superior and medial concave or turbinated processes. This is all about the cranial bones. Now, moving toward the facial bone, there are 14 facial bones. The skeleton of the face is formed by 13 bones of 13 bones in addition to the frontal bone already described. The 13 bones face plus 1 bone vomer. The total number of bone are 14, 2 zygomatic bone, 1 maxilla bone, 2 nasal bone, 2 lacrimal bones, 1 vomer, 2 palatine bone, 2 inferior concave, 1 mandible. The first bone we're talking about is zygomatic bone. The zygomatic bone originate as two bones that fuse before birth. They form the prominence of the cheek and part of the floor and lateral wall of the orbital cavities. The second bone is maxilla. These originate as two bones, but fusion takes place before birth. The maxilla forms the upper jaw, the anterior part of the roof of the mouth, the lateral wall of the nasal cavity, and part of the floor of the orbital cavity. The alveolar ridge or processes project downward and carry the upper tip. On each side, there is a large air sinus, the maxillary sinus, linked with ciliated mucous membrane and with opening into the nasal cavity. The next bone is nasal bone. There are two small flat bones that forms the greater part of lateral and superior surface of the bridge of the nose. The next bone is lacrimal bone. These two small bones are posterior and lateral to the nasal bone and forms the part of medial wall of the orbital cavities. Each is pierced by a foramen for the passage of nasolacrimal duct that carries tears from medial canthus of the eye to the nasal cavity. The next bone is palatine bone. There are two small L-shaped bones. The horizontal part unite to form the posterior part of the hard palate, and the perpendicular part project upward to form part of the lateral wall of the nasal cavity. At the upper extremities, they form part of the orbital cavities. The next bone is inferior nasal concave. Each concha is a scroll-shaped bone which forms part of lateral wall of the nasal cavity and project into it below the middle concha. The superior and medial concha are the part of ethmoid bone. The concha collectively increase the surface area in the nasal cavity, allowing inspired air to be warmed and humidify more effectively. The next bone is mandible. This is the lower jaw, the only movable bone of the skull. It originates as two parts that unite at the midline. Each half consists of two main parts, a curved body with a alveolar ridge containing the lower teeth and a ramus, which project upward almost at right angle to the posterior end of the body. Now, this is all about the facial bone. Now, there are six bone known as ear bone or ossicle of the middle ear. Three are present on the left ear and three are present in the right ear. The name are malleus, incus, and stapes. The next bone is hyoid bone. The hyoid bone is an isolated horseshoe-shaped bone lying in the soft tissue of the neck just above the larynx and below the mandible. It does not articulate with any other bone, but it is attached to the styloid process of the temporal bone by ligament. It supports the larynx and gives attachment to the base of the tongue. Now, next one is thorax. The thorax total contains 25 bones, in which 24 bones are of ribs and one of is sternum. The thorax is formed by the sternum anteriorly, 12 pair of ribs forming lateral bony cage and 12 thoracic vertebrae. Now, first of all, about the sternum. The sternum is flat bone, can be felt just under the skin in the middle of the front of the chest. The manubrium is the uppermost section and articulate with the clavicle at the sternoclavicular joint with the first two pair of ribs. The body or middle portion, give attachment to the ribs. The xiphoid process is the tip of the bone. It gives attachment to the diaphragm muscle of the anterior abdominal wall and linea alba. Now about the ribs. 12 pair of ribs from the lateral wall of the thoracic cage. They are elongated, curved bones that articulate posteriorly with the vertebral column. Anteriorly, the first 7 pair of ribs articulate directly with the sternum and are known as true ribs, that is first to 7. The next 3 pair articulate only indirectly. In both cases, costal cartilage attaches the ribs to the sternum. The lowest 2 pair of ribs refer as floating ribs. They do not join sternum at all, their anterior tips being free. The first 7 ribs are true ribs. From 8 to 12, it is false rib, and 11 and 12 are also known as floating ribs. Now, about the vertebral column. There are 26 bones in the vertebral column. 24 separate vertebrae extend downward from the occipital bone of the skull. Then there is a sacrum formed from 5 fused vertebrae, and lastly the coccyx or tail, which is formed from between 3 to 5 small fused vertebrae. The vertebrae column is divided into different regions. The first 7 vertebrae in the neck, known as cervical spine or cervical curvature. The next 12 vertebrae are the thoracic spine or thoracic curvature. The next 5 are lumbar spine or lumbar curvature, the lowest vertebra which articulate with the sacrum. Each vertebrae is identified by the first letter of region in the spine, followed by the number indicating its position. For example, the topmost vertebra called C1 and third lumbar vertebra is called L3. The movable vertebra have characteristics in common, but some groups have distinguished features. Now, first of all, cervical vertebrae or cervical curvature. These are the smallest vertebrae. Transverse process have a foramen through which a vertebral artery passes upward to the brain. The first two cervical vertebrae, the atlas and the axis. The first cervical vertebrae, the atlas, is the bone on which skull rests. Below the atlas is a axis, the second cervical vertebrae. The atlas is essentially a ring of bone with no distinct body or spinous process, although it has two short transverse processes. It processes two flattened facet that articulate with the occipital bone. These are condyloid joint and they permit nodding of the head. Now, the second thoracic curvature or thoracic vertebrae or thoracic spine. The 12 thoracic vertebrae are larger than the cervical vertebrae because this section of the vertebral column has to support more body weight. The bodies and the transverse process have facet for articulation with the ribs. The next one is lumbar curvature or lumbar spine or lumbar vertebrae. These are the largest of the vertebrae because they have to support the weight of the upper body. They have substantial spinous processes for the attachment of the muscle of lower back. The next one is sacrum. These consist of 5 rudimentary vertebrae fused to form a triangular or wedge-shaped bone with a concave anterior surface. The upper part or base articulate with fifth lumbar vertebrae. On each side it articulate with the ilium to form sacroiliac joint and its inferior tip articulate with the coccyx. The anterior edge of the base, the promontory, protrude into the pelvic cavity. The vertebral foramina are present on each side of the bone. There is a series of foramina for the passage of nerve. Now, the last one is coccyx. These consist of 4 terminal vertebrae fused to form a very small triangular bone, the broad base of which articulate with the tip of the sacrum. This is all about the axial skeleton. Total number of bone is 80 bones. Thank you very much from Modern Institute of Pharmaceutical Sciences, Indore. For more video about pharmaceutical sciences, kindly join and subscribe Modern Institute of Pharmaceutical Sciences, Indore YouTube page. Thank you very much.